medicine and surgery have changed tremendously. This happened thanks to the introduction of a vast variety of new invasive technologies for skin rejuvenation and enhancement. Injectable products are the main cause for face, but for the rest of the body too. But what about volumetry? It can seem new for some people, and I'd like to introduce two experts of this segment, which is first Dr. Benjamin Asher, who's plastic surgeon from Paris, France, and of course the IMCAS scientific director, who welcomes everyone in here. And with you we have Dr. GRAIVIER. You're also plastic surgeon, very famous plastic surgeon, insisted Dr. Asher, and you're from Atlanta in the US. So we'll have both points of view on these matters. First, let's make a little definition. What's the difference between traditional fillers and volumetry, Dr. Asher?
The fillers are dedicated to the lines, and the volumetry is dedicated to the loss of volume. So that's a total new world of development, and is dedicated not only to the deep layer of the face as well as the body, but we'll see to a certain part of the superficial layers. Meaning that it's a total new segment of our profession, our development, of course with the same product, meaning the hyaluronic acid and the long-lasting filler, but with a new area concerning the development.
So for example, you both use these different products, but you use them differently. Is there a difference of use, of practice between Europe and the States? For example, Dr. GRAIVIER, when you use
there's a lot more products available in Europe because our FDA has limited the number of products that we have available. So of our products, my life is made a little bit easier than Benjamin's because we have only a few products to select from. So very often in terms of volumetry and contour, where we're also trying to treat not just the lines, but also to augment the changes that occur in people, the bony changes, because the bony skeleton atrophies and becomes thinner over time, as well as the loss of the volume of the face, as well as the body. So we can use a little longer lasting filler to correct some of these changes, not just of the soft tissue, but also to try and address some of the changes in the bone. So in the United States, we have the availability of multiple fillers, not just hyaluronic acid fillers, but some that we can use, such as calcium hydroxyapatite or Sculptra, which is polyl-lactic acid, and we can place them in the plane just above the bone to actually use them almost like a liquid implant, where it elevates some of the tissue above it, and we're also affecting some of the deep fat compartments that has a cascading effect. So while we place some in one area, for instance in the cheek, we're probably going to get a little lift to the rest of the face. So we're finding that we're affecting other areas of the face when we're rejuvenating that volume. And then we can also address the line components and the lip components with that.
And I think that, for example, specialists or experts like Dr. Lambros were among the first to talk about volumes and volumetry. Did they help all these studies to understand better how volumes evolve in the time?
Totally. You know, we are plastic surgeons, so we are dealing first with the anatomy. And anatomy is essential, not only for the plastic surgeon, of course, for the dermatologist, for every expert dedicated to this sort of field. From the anatomy, we understand everything. We understand where is the loss of fat, where is the sagging of the tissue, because we need to analyze also the sagging. And with these two components, we know many things concerning where we have to put the product. But let me insist on the fact that more and more now, we are not so attached to the deepest layers concerning the volumetry. We are going to inject mostly, that's the European feeling, let's see concerning the US feeling, more and more on the hypodermis, so a little bit more upper, and the most part of the time, we employ a more superficial attack for the volumetric product, meaning the thickest waist or the most important product concerning, of course, the fact that is quite important about the result. But on the same time, on the same area, we inject as a sandwich technique a classic product, a little bit more light, very much more close to the epidermis or to the superficial dermis. So with these two combinations, on the deep layers, the volumetric product, and on the upper layers, the classic product, we win because we have a better clinical assessment, and also it's very relevant concerning the cost, and everything is cost relevant.
Dr. GRAIVIER, you don't do the same thing exactly?
No, we actually do. Benjamin and I feel very much the same regarding that, in that we are doing a multi-planar approach, meaning we are doing some lifting of the deeper layers to also help not only the bony atrophy, but to lift the tissue. But above that, we're now having better and better fillers that are treating the dermis or the layers of the skin to make that even better. So that we're having a lot of improvement and having better products and learning how to use them better. So it is a sandwiching where we're addressing the two areas.
And the result is more natural, more long-lasting?
Absolutely.
Yes.
We don't like the balloon face, don't mistake. You know, we like the natural face, we don't like the caricatural face. So the same thing concerning the toxin, we don't like the frozen face. On the same level of what we are absolutely not promoting, we are absolutely horrified by the balloon faces. So we need to be at any moment on a very soft attitude, very limited concerning what we need to deal concerning the volume of injection, and the touch-up could be quite interesting. So it's a step-by-step injection, and that's of course the good deal. So we are going to inject on a good amount of product concerning, let's say, the first treatment. Then we will have the second rendezvous between, let's say, 3 weeks to 1 month and a half, and if it's necessary, why not augment the quality of the result by a little touch-up.
Okay, Dr. Graivier, we have the impression that a full rejuvenation of the face is today the referred trend. Is it the case according to you?
Yes, I think that we've learned that we have to not only refill. In some instances, we have to retighten. For instance, in the neck and jowl area, and the lower portion of the face is not as amenable to filling. It's more where we lose more volume is in the upper portion and the mid portion of the face. So we do have to add to that. The additional thing that we have today that technology is improving is our skin treatment as well, where we are able to address pigmented issues, facial veins, irregularities, and the lines also, in addition to fillers, but also with laser treatments, with skin care treatments, with peels, and with home cosmeceuticals. So in the end, I think that 1 + 1 + 1 does not equal 3, it now equals 10.
Okay, but is it affordable?
Yes, and the nice part about these treatments is they are affordable, and there's no downtime to speak of, not like a surgical downtime.
Okay, to end, I'd like to talk about the rest of the body, because we speak a lot about the face, but the body is also targeted.
Yes, absolutely. Actually, we could say that we are just at the beginning. We have quite a good challenge. The first QMET product introduced, of course, with the macrolens, the possibility to inject the hyaluronic acid in a certain part of the body, like the breast and the chest. But the most part of the time, we don't have a long-term follow-up concerning the assessment about the clinical trials. So for the moment, we need to be safe, to be a little bit conservative, but definitely for the future, we know that we are going to have quite a wonderful volumetry for the body.
Okay, thank you very much. We have an idea of what future will be done of, and I thank very much Dr. Benjamin Asher and of course Dr. Graivier for your participation. Thanks a lot.
Thank you very much.